Well, hello, I'm Cynthia,
And I'm Melanie.
and today we'll be discussing oral manifestations during pregnancy.
In today's presentation, we'll be discussing gingivitis, pregnancy gingivitis, pyogenic granuloma, and how to focus on good oral care. Okay. It all begins with plaque. Plaque is a white to yellow thick coating that gathers on the teeth. This plaque can also contain bacteria. The same plaque can contribute to many oral manifestations, including gingivitis and cavities. It begins to grow on your teeth due to the lack of brushing and flossing. Therefore, good oral hygiene during pregnancy is highly recommended.
One of the oral manifestations that could occur while you're pregnant is gingivitis. Now you would say, what is gingivitis? Now gingivitis is the inflammation of the gums, including redness and also bleeding. This redness and inflammation with bleeding is caused from plaque. Plaque accumulation contains bacteria, and this bacteria causes all these side effects. In pregnancy, getting gingivitis is a high risk. Pregnancy gingivitis occurs in 50 to 70% of pregnant women. This is caused due to the hormone increase. One of the hormones that increases is progesterone. And progesterone makes it easier for gingivitis causing bacteria to grow. Gum tissue is more sensitive to plaque. An exaggerated body response occurs due to the toxins in the plaque. So therefore, your body is fighting a toxin in the plaque. That is why you have inflammation and redness. Poor oral hygiene, such as brushing and flossing, can also cause pregnancy gingivitis. Another oral manifestation that can occur while you're pregnant is called pyogenic granuloma. Also known as pregnancy tumor. Even though it has the word tumor in it, it doesn't mean it's cancer. This is a non-cancerous mass that is found in the gums. It is not a danger to you and not a danger to your child. This occurs in about 5% of all pregnancies. It will most likely occur during your second and third trimester, as well due to the increase of hormones and also gingivitis. Removal of this mass or tumor can be done while you're pregnant or after you give birth. And once you remove it, it will be unlikely that it will occur again.
The importance of oral hygiene during pregnancy is to prevent gingivitis, also known as gum disease. Research shows that bacteria accumulation during pregnancy gingivitis can also lead to preterm labor, meaning your baby can be delivered early if you do not take care of your oral health. Preterm labor can also have developmental side effects on the baby and should be avoided. Good home oral hygiene includes brushing at least 2 times a day for 2 minutes each time that you brush. You can utilize tools such as kitchen timers or your phone to time yourself. We also recommend flossing at least 1 time a day. You can either use a floss pick or just a regular floss would work. And use a tongue cleaner. This will help remove bacteria from the tongue. And you can also use alcohol-free antimicrobial mouth rinse, and toothpaste with fluoride is highly recommended.
And now we will show you ways on how to properly brush and how to properly floss your teeth. First, you want to get a soft bristle toothbrush. Do not avoid getting anything that is hard bristle or medium bristle, especially with your inflammation due to gingivitis. It could cause irritation and make things worse. So try to just buy soft bristle toothbrush. When in your package, it should say an S for soft. Technique to use during brushing is called a modified Bass technique. And this will allow you to remove all the plaque from underneath your gums. So the way you do a modified Bass technique is you place your toothbrush along your teeth, and then you angle your toothbrush up to a 45-degree angle, and you use a back and forth circular motion. This allows the bristles of your toothbrush to sweep underneath your gums, removing all the plaque. And then for the bottom anterior teeth, you want to place your toothbrush up like this and go up and down. This will allow all plaque from the back of your teeth to be removed properly. And as well for the top middle teeth, you want to go up and down along the front of your teeth. And this will allow also the plaque to be removed from behind your teeth. And then now Melanie is going to properly teach you how to floss your teeth.
So now I'm going to teach you guys how to do the C-shaped flossing. First, you want to get your floss at about this length, and you want to wrap it around your middle fingers, both sides. So you have your index fingers and your thumb open so that it'll help you maneuver into the teeth, the floss into the teeth. So I'm gonna go ahead and get started. What you want to do is just wrap it around your middle fingers. Instead of doing the clicking and popping, which is just clicking it in, you want to actually do C-shaped motion, which is you seesaw in, you hug it around the tooth like this, and you go up and down to remove all that plaque off the teeth. And again, you'll switch over to the other two, and you'll do the same thing. You hug the tooth, go up and down to remove the plaque. This will ensure that all of the plaque are removed, and then you'll go ahead and gently slide it back up. Due to morning sickness, vomiting and nausea can occur. We do not recommend brushing your teeth immediately after vomiting. Instead, rinse with water. Brushing after vomiting causes reduction of the protective enamel. Tools to prevention includes oral home care, maintain a good diet, try to incorporate arginine foods such as nuts, cheese, whole grains, seafood, eggs, soy, and spinach. You can also utilize gums that contain xylitol, such as icebreaker gums or trident gums. The ADA recommends regular dental visits at least every 6 months. This can be scheduled with your primary dental provider, or a complimentary dental screening can be provided at Loma University Dental Hygiene Clinic. And routine dental visits do not excuse you from daily oral care.
Regular dental visits are best done during your second trimester. You want to avoid visiting the dentist during your third trimester only because the weight of the belly has increased and it will be uncomfortable. Also, it has been associated with preterm labor. In the first trimester, it is a very critical time of development for the child, so it's best to avoid treatment during this time. During your dental visits, nitrous oxide, also known as laughing gas, it is not recommended. So if you need nitrous gas in all your dental appointments, it is best to postpone your dental appointments for after birth. Anesthesia, no local anesthesia, it is safe and can be done at all appointments. X-rays are better if done after birth or before birth. Avoid all X-rays during pregnancy. In conclusion, now that you're aware of pregnancy manifestations, you will be able to keep good oral health by flossing and brushing correctly, as well have regular dental visits that will keep you in good health and be stress free during this time.